Hey y'all, welcome back to my channel. My name is Patrice and I'm a family nurse practitioner that works full-time in internal medicine and PRN in urgent care. Today I wanted to talk about a little bit about my nursing journey. So maybe I can inspire someone, or maybe if anyone was ever wondering what steps I took to get to where I'm at today. So if you're interested in watching how I became a doctoral prepared nurse practitioner, then keep on watching. Hello, welcome back to my channel. For those that don't know me, my name is Patrice and this is my DNP life. I am a family nurse practitioner who works full-time in internal medicine and PRN in urgent care. Right now I'm headed to work and I kind of wanted to talk about my nursing journey. So my nursing journey started off pretty non-traditional. I joined the military, started off as a medic, worked in, I guess, like a soldier's clinic, and I was working with a nurse practitioner at the time, a major, and he said you should go to nursing school. And I was like, no, I don't want to go to nursing school. My mom's a nurse, my aunt's a nurse, like everybody in my family is a nurse, and I really didn't want to do that. So after, he kept talking about it, I decided that I would do the Army's licensed practical nurse program. So I did that for a year, did my training in San Antonio and then in Augusta, Georgia. And I went back to my duty station and I worked in labor and delivery, which I absolutely hated. And then I ended up doing a little bit of med-surg, and then I worked in the PACU until I decided to get out the Army once I finished my ADN program. So I completed my ADN program, got out of the military, and went straight into a BSN program. As I was completing my BSN program, I started off in med-surg again, and then I worked in a small community hospital, very rural. My husband's active duty as well, so we were in a very small place, and I wanted to do ICU, and ICU it was never available. So one day, you're gonna work in ICU, and I'm like, okay. One of the nurses that worked in ICU, was a very small ICU, 6 beds. She broke her leg, and I ended up getting her position, and I thought it was temporary, but it turns out that I started in ICU and I never left. So I absolutely loved doing ICU. I love the high acuity. We only had 2 patients. It was just, I really loved doing that. I loved being on my toes. I loved having to know your shit when it comes to nursing. But as I was working in ICU as a bedside nurse, after a while, I just saw so many things that were unethical. And I felt like at the level of a bedside nurse, I couldn't do as much as I wanted to do for my patients. So I decided that eventually I wanted to go back to school to be a nurse practitioner. So I worked as a bedside nurse in ICU. I went from a smaller ICU to a large ICU, worked there for a little while, and then I decided I'm gonna go back to school and get my master's degree. But I wanted to do education as well. So I went and got a master's in nursing education, and I taught in a small community college in Texas for 3 years. First, I started off with first semester students, and then I went to third semester students, doing both didactic and clinical education, and I absolutely loved it. did that for 3 years, and once again I got that itch. I need to be doing something else. I need to be, I don't know, I just wasn't, I love my job, but I wasn't fully content with just working with the students. I missed being with the patients. I missed that type of interaction. Even though I was still in a clinical setting, my focus was more on the students and making sure they were learning what they needed to learn, but I didn't get to interact with the patients. So went back and did a postmaster's nurse practitioner program, completed my clinicals. Once I did that, I went automatically into urgent care once I finished school. And then while doing that part-time, I got offered a job in internal medicine. So my whole nurse practitioner career, I've pretty much been working in internal medicine and urgent care. I've done a little bit of family practice, but I only see children if there's not a slot available in my internal medicine practice. So I'm doing that now, and I've been doing that for a while. But, you know, as I was working, I felt like I have job satisfaction. I love that I can help my patients. You know, I don't feel like there's anything that, I felt like I was able to be a nurse and treat the patients at the highest capability as a nurse. So I felt very fulfilled, but then again, I got this itch where I am a stickler for education, and I still had free money from being in the military, free education money. So I decided to do an accelerated doctoral program, all while working full-time as an NP in internal medicine and PRN in urgent care, all while my husband was deployed to Afghanistan. So that was probably the most stressful time in my life. There were so many times where I wanted to quit because you had to do clinical training still, as well as research. So when I did my doctoral program, I did my research, or my thesis was standardizing STD care in a women's health clinic, low-income women's health clinic in a small rural community, federally funded clinic. So I did that research for a year, and like I said, it was the most stressful time that I've ever had in school. And I was at the point where I was actually like, I don't need to get a doctorate to work as a nurse practitioner. I can just quit, you know. But one of the professors at the school that I went to, she, my school was very one-on-one. They made sure that you stayed on track as far as when you did your research, you didn't go too far left. So I had very good professors. And one of the professors told me, she said, all you have to do is get a B in each of your courses. Just get a B and you'll be done. And then you can have that title, and you can say that you've reached your terminal degree. And so when she did that, when she said that, I was like, you know, she's right. She was telling me about her background, and she did her nurse practitioner program while she was pregnant, and then she had a small child, a toddler, and she was working full-time as a nurse practitioner as well as working on her doctorate. And I was like, if she can do it, I can do it. She's sitting over there with 2 small children. I can do it with, it's just me here. So needless to say, I buckled down and I completed that program, and now here I am with the doctorate, still doing the same thing satisfaction of saying that I guess proving to myself that I've gone as high as I can as a nurse. And so now we are a couple years later, and I'm getting that itch again to start adding certifications. And so I'm trying to decide, since I've been in critical care pretty much my whole nursing career, do I want to get my acute care certification? I'm not very good with mental health. Do I want to do mental health? But now I'm trying to decide what's the best next route for me. Now, my husband is like, if you don't sit down somewhere, you know, you've done all this. But at the same time, he knows that once I get my mind set on completing something, then it is what it is. Like, I just do it. So that's my next goal. But the point of this video really is to show that there's so many ways to get to where you want to be. So like I said, I went from Army medic to Army LVN or LPN to RN with an ADN to RN with a BSN to RN with the Master's in Nursing Education, then Postmaster's Family Nurse Practitioner, and then on to my Doctorate in Nursing Practice. So I hope this video helps someone see that you don't have to go to a 4-year nursing school straight out of high school, 4-year program, and then go into a 2 years master's or 4 years doctorate to be a nurse practitioner. There's so many steps, and I feel like being in each of those roles, it helps me understand that, one, you didn't know everything that you thought you knew. There's always room for learning and growth. And two, I have so much respect for everybody that I currently work with, because I've been in every role. So needless to say that I hope this video is helpful to someone that feels like they're stuck at a certain position, nursing position. There's always a way to get to where you want to be if you work hard. Thank you for watching.